Good evening, everyone. Welcome to this evening's Facebook Live at Breast Cancer Now. My name's Jane. I'm one of the nurses at the organisation, and this evening we have got our general Q&A session. So, any questions that you've got, please post them. We'll get to them as we go through the session wherever possible. Anything we don't answer, we will get to tomorrow. So, like I say, though, we will try and do as much as we can throughout the session. Do remember that this is a public forum, so anything that you post will be seen by other people, and your name as well. So, but don't forget we have the helpline which you can call, which is completely confidential and anonymous on 0808 800 6000. And you can call that with any other questions that you might have or anything that you think of after the session's finished. I'm joined by my colleague Sally, and between us we'll be going through some of the questions that we have had already and then going through the live questions. So, Sally, did you want to introduce yourself?
Thanks, Jane. Yep. Hi, everyone. I'm Jane's colleague. I'm one of the nurses at Breast Cancer Now. Welcome to this live session.
Great, thanks ever so much. So what we'll do is we'll start. We've had a few questions in already, so I'm just going to pull those up and we'll go through those. And then, like I say, just pop your questions. You just post anything that you want to ask us. Some things we won't be able to necessarily answer, but we'll do. We'll answer what we can. And like I say, we'll get back to you if we're not able to or we run out of time. So let's kick off, Sally. What I'm going to do is Hunain has asked about having a lump on the breast. Is it dangerous?
Right. So, Helene, obviously it sounds like you've noticed something that's not normal for you, and our kind of breast awareness messaging is about knowing you're normal. And if you find something that's not normal for you, then our touch look check is that touch. They're looking for any abnormality. And I think, one of the key parts for you in this is the check. So, what I'd say is, do you really should see your doctor and be referred to a breast clinic to find out what that breast lump is. It's very difficult without kind of a specialist breast assessment. I guess the things that we do know is that 9 out of 10 people that go to a breast clinic don't have breast cancer. But what we know for those who are diagnosed, that it's important to get things checked out as soon as possible, and that if someone is diagnosed with breast cancer, the sooner they have treatment, the more likely the better outcomes from that. So the key thing is about going to see your GP, and most likely to a breast clinic. I guess, Jane, the thing to acknowledge, and what we hear on the helpline from lots of people when they find a change in their breast, such as a lump, that actually that can be anxiety provoking for some. It can be a bit of a
Definitely.
worry. And I think the uncertainty and the waiting to see a specialist in the clinic can be really, really challenging for some people. And we talk to people about kind of differing ways of coping with that anxiety and that waiting. We do have some really good health information on our website of what to expect at a breast clinic. So for some people, it's if they've never been to a breast clinic before, they don't know what to expect. Actually, it can be helpful to feel kind of informed, and that can maybe kind of take some of those concerns away.
Yeah, and also on the website there is, like you say, the touch look check messaging. So, because sometimes people, I think a lump is the most a common symptom or that people are aware of that they need to check for, but there are other symptoms as well to be aware of, aren't there? So we do talk about that on our information on our website. So things like puckering of the skin, if there's an unusual nipple discharge, if the nipple becomes inverted when it isn't normally inverted, and different sort of other symptoms to be aware of, which, like I say, and like Sally says, are all available on the website. So anything like that, do check that out. And as Sally says, off to the GP to get that checked out. That's the most important thing.
Yeah, and there's no expectation in that for people to know what the abnormality is. That is the role of the healthcare professionals. So I think it is, if you notice anything that's not normal for you, then get it checked out, and don't ever feel like you're bothering healthcare professionals, whether you have an assessment and it isn't breast cancer, then that's not bothering people. That's getting it checked out. And I think some
Yeah.
people do worry that they
Yeah.
whether to get everything checked out, or are they bothering a busy kind of healthcare professional teams.
Yeah, like you say, we often hear on the helpline, oh, I don't want to bother my GP if it's nothing to worry about. Well, you don't know until you see your
Yeah.
GP and get it assessed. And so moving on to Hayley's point, which kind of is linked to that really. So Hayley's asking, can I book an appointment or do I need the GP to do it? I'm wondering if I'm not sure if Hayley's talking about a breast clinic appointment or a screening appointment. So perhaps we can talk about both. You've kind of covered a bit about the breast clinic appointment, but
Yeah, the
um,
breast clinic generally is from a referral via your GP, unless there are any people who are kind of undergoing follow up in a breast clinic. Then sometimes they can kind of re-access the clinic that way. But if it's new symptoms, you've never been to a clinic before, then it is seeing your GP, and it's important that they can then relay any medical history or anything that the clinic would need to know about, so that they would meet someone's needs. If someone had kind of specific needs, perhaps they wanted to ask if it's possible to see a female clinician, or just any specific needs. I think the GP can do the communication to the clinic for that. So
and if sorry,
no, that's okay.
I was going to say if Hayley's actually asking about a breast screening appointment, if a screening mammogram, um, that doesn't have to be through the GP, does it?
No, so what we know is the NHS breast screening programme are 3 yearly mammograms for women aged 50 to 71. So as long as you're registered with a GP, then when the breast screening service is in your area, then you'll automatically be invited. If you receive a letter that says you're eligible for breast screening, you need to phone up and make an appointment. In some cases that's the way. In other cases they send you a booked appointment, kind of time and date, and if you can't make it, there's contact details. But you should be called for your first breast screening mammogram between 50 and 53, between your 50th and your 53rd birthday, and then you continue having them every 3 years. After the age of 71, people can do what we call self-referral, so they can ask to continue breast screening, and that's just about balancing the risks and benefits and whether that was something that someone wanted to continue. And again, talk to your local breast screening unit. If you're unsure of your local breast screening unit's details, you weren't, sometimes time can feel like it's gone really quickly or really slowly, and some people aren't always aware when they had their last screening. The NHS website you can access the breast screening details. So by putting in your postcode, you can find out the details of your local breast screening unit, and then you can give them a call. And if you've got an NHS number or a breast screening number, that's helpful. But otherwise, they'll go through your details and help you through that process.
Yeah, and just going back to the point again, we about if you're over 70, lots of women think they're not entitled to screening after the age of 70, 71, but it's that you just don't get that routine invite, so you can, as you say, self-refer. It's not that you're not entitled.
Yeah.
It's, as you say, balancing the risk and the benefits in that age group. So yeah, I'm having a bit of difficulty seeing the questions coming through. So I don't know if you can see them, Sally.
I
What
can't
I'll
see
do is
them.
I'll carry on with what we've got so
Yeah.
far. So Artie is asking, is it genetic? I mean, if I have a child, will my child have this? It sounds as if perhaps Artie has a breast cancer diagnosis. And again, this is something that we're asked a lot, isn't it? If someone's got a diagnosis of breast cancer, will they pass it on to their children?
Yeah, I think that's a really common question, and an understandable question. But what we know is that not all breast cancers are genetically related, so they're not related to a family history. So the statistics are somewhere in the region of kind of 5 to 10%. So that means that 90 to 95% aren't, genetic or family history related. I think if someone has concerns about their family history, whether that's someone that has been diagnosed with breast cancer, then certainly speak to your treatment team and they can talk to you, go through your family history and whether any kind of ongoing referral to a genetics unit is indicated. If someone hasn't had a breast cancer diagnosis and they're concerned that there is some history in their family of breast cancers, then it's going to your GP, having a chat with them, and dependent on that assessment, sometimes you're then referred to a family history clinic for further assessment, and that often means filling out a questionnaire about your maternal, so your mum's side and your paternal side, because they're assessed separately. And people can be assessed either being kind of what we call near population risk, so they're not at any increased risk than the rest of the population. Other people can have a moderately increased risk. Other people can be a high risk. And some people will go on and have genetic testing, and we know of specific genes related to breast cancer, but not everyone goes through all of those steps. So the key thing is about talking to either your healthcare professional, as I said, if you're currently being treated, but if you're concerned, go to your GP. Again, we've got some great information on our website about family history and genetics.
Yeah, that's really clear about what the GP needs to know to assess somebody, or obviously, Artie, if you've already got a cancer diagnosis, your treatment team it's something that they can help you with. But yeah, there's a lot of useful information on our website about that. That's very clear and very makes it a lot of sense of what can feel like a bit of a complicated topic, but
Yeah. And
it's really.
again, if you're going through treatment, that is any concern that you have is a concern that your healthcare professional team or we're happy to talk through on the helpline, because some people, again, it's just making sure that if you've got any concerns, that you talk about them and you ask questions, because if you're then reassured that there isn't any increased risk for your family history, at least you've asked the question, and if you were eligible for any kind of enhanced screening, so additional screening because of a family history, or you were concerned about members of your family, then it's best to see someone and get that checked out and
Yeah,
instigated if needed. Again,
yeah,
it's that kind of uncertainty and worry. Do please ask and don't.
yeah, yeah, exactly. Um, Wendy's asked about a grade 3 breast cancer. It might be a good idea to sort of talk about the difference between stage and grade. So, but Wendy's asking, is grade 3 breast cancer more likely to spread to other organs? And again, things like grade and stage aren't taken in isolation, are they?
No, did you want to answer that question, Jane? I feel like
Yeah,
I've been
sure.
talking.
So grade refers to how fast or slow growing the cancer is, and when they look at the cells under the microscope, if the breast cells have changed quite significantly, it's a higher grade, so grade 3, so that it's changing more quickly, and it is more, or has the potential to spread, is what they would call faster growing. But that's separate to stage. A stage is the size of the actual tumour, and whether it's gone to lymph nodes or anywhere else in the body. So you could have a grade 3 cancer, but it might be a small tumour. It might not be in any lymph nodes. So it's really difficult, Wendy, just to take a grade or a stage or any of these kind of things in isolation. What your treatment team will be doing is we'll be looking at all the different factors, not just those two things, but a whole range of different things that helps them understand how your breast cancer may behave and what the most effective treatments are likely to be for your situation. And that treatment would be agreed by a team of different healthcare professionals. So the pathologist who's looking at the breast tissue, the oncologist who prescribes the medicines and the radiology, and the surgeon, and they will agree based on all these different things, as well as your wishes, what the best treatment would be in your situation. So if you do have a grade 3 tumour, don't assume that that's
Yeah.
sort of foregone conclusion that that is what's going to happen, because there's a whole range of different things that will be taken into account to, like I say, assess how it's likely to behave
Yeah.
and work out the best treatment for you.
And I guess what we know is the grade of the cancer is often found in the biopsy result.
Mm.
The staging needs more information, such as following your surgery, so
Mm.
accurate sizing of a cancer that you've had, and also kind of the outcome of the lymph node surgery. So
Mm.
some of this information comes in parts, and I think that can sometimes, as other things we've talked about, cause some kind of anxiety, because it's
Mm.
waiting, it's more waiting and uncertainty. But
Yeah.
yeah, I agree. I think it's not making assumptions that all cancers of this grade behave a certain way, and all
Yeah.
because yeah, what we know is that's not always the case.
No, and I think some people think, understandably, that perhaps things have changed. So, as you say, like in biopsy, you might have sort of a grade, but then when they do the surgery, it's a different grade, and it doesn't mean to say that it's necessarily changed in that time, but it's just that they're analysing a larger piece of tissue, so
Yeah,
you could have a mix of grades within that tumour.
yeah, which yeah, and I we can see that can sometimes feel kind of, it's a lots of information to navigate your way through when
Mm.
when sometimes in a really uncertain situation what you're looking for is certainty. So I think it's if you're sitting down with your breast care nurse and going through your histology results to kind of understand them. Again, we've got some great information on the on our website, specifically about understanding your pathology results. If you find that helpful, some people it's need to know basis, and other people quite rightly want more detail. And there's no right or wrong. It's just
Mm.
it's making sure that your information needs, whatever they are met by perhaps asking questions or asking things to be explained, and you know in language that as healthcare professionals we can use some terminology that we are used to using, but it's just about meeting the needs of the people that we're supporting in whatever way they need.
Mm. Mm. And Charlotte's asked a question about the best way to support someone with stage 4 breast cancer. So this is when it has spread to another organ or organs, and the treatment is aimed at controlling the cancer, controlling symptoms, improving sort of quality of life for as long as possible. So it's no longer are you able to treat it and the cancer's gone. It's trying to control the cancer. And I think, Charlotte, that really kind of depends on the person it is that you're supporting, the relationship that you have with them. Again, I do feel like we are sort of saying everything's on the website, but we really do have some really good information on our website about supporting somebody with stage 4 breast cancer. I'd really encourage you to give us a ring and talk this through with our nurses on the helpline tomorrow, because we can perhaps sort of find out a little bit more about what your relationship is, what their situation is. We do know that lots of women and people living with stage 4 breast cancer can have a very good quality of life for a long time. So I think for that it really be a good idea to get some more details about the situation and the person it is that you're supporting. So if you can, do give us a ring, or drop us an email at nurse@breastcancernow.org, and we'll with more information, we'll be able to give you a more detailed response that's relevant to your individual or the person's individual situation.
Yeah, I mean, I guess some general advice. As you say, it'd be really helpful to kind of know more details. But
Mm.
I guess it's being guided by the person as
Mm.
well that you're supporting, because and kind of those kind of open questions are, how are things going for you? How are you? Trying to gauge with them what's going on for them, because what we know through the work we do at Breast Cancer Now, quite rightly, everyone's an individual and people have different support needs. For some people, it might be physical needs. They might need some support in picking kids up from school, or I don't know, going shopping. And other people might want more kind of emotional support. So sometimes that's just someone to listen to what's going through their head that day, they often don't expect you to solve all of their concerns, but just some people just find it really helpful for someone just to listen. So I think,
Mm.
yeah, it's really be gauge, gauge the person by the person that you're trying to support, because sometimes they may want to have a day where they kind of don't want to think about their breast cancer and what's going on for them, and a day where they do really want to talk about how they're feeling. And with secondary breast cancer, some of the kind of impact of that can be really, really difficult for people, and they may want to kind of voice that.
Mm. Mm. I think sometimes on the helpline, often we don't necessarily have the answers, but a lot of people just say thank you for listening, because that
Yeah,
is, because perhaps their healthcare professional understandably doesn't have the time to sit and listen just to how they're feeling. They might not want to sort of burden family and friends, but I think, yeah, I mean, very often it is about just having someone that will listen to what they're saying, and it's something that we hear a lot
yeah, and I think if you are supporting
on
someone
the
that has
helpline.
breast cancer, it's also making sure that you're supported as well.
Yes, absolutely.
And
Yeah.
again, whatever way you would need support, because that might be different to the person that you're supporting, and
Mm.
that's fine to say, I need some support as well.
Yeah, good
And
point.
we talk to,
Yeah.
don't we? We talk to family and friends on the
Yeah.
helpline.
Yeah.
Yeah.
Yeah. Everybody and anybody. So Alison's asked, hi there, just had radiotherapy 3 weeks ago. Is it normal to have some pain? Thanks. Do you want to go for
Yeah,
that
so I
one?
saw that question, and obviously we're presuming, Alison, this is radiotherapy to either breast tissue after what we call a lumpectomy or a wide lobe excision, or some people do have radiotherapy to their chest wall after a mastectomy. Um, yeah, I think that it can be painful, uncomfortable, whatever kind of word you want to describe it, because again, that'll be different for everyone. But I guess this is radiotherapy is generally after treatment such as surgery and sometimes chemotherapy. So there can be some post-operative tenderness there, and then the radiotherapy can cause some soreness of the skin, and some changes there. Sometimes there's some discomfort still under the arm from the auxiliary surgery. So I guess it's really about getting an assessment of that pain with your clinical team, and they can talk you through anything that may help, depending on kind of where the pain is, what they think is causing it. But I think that's not unusual for people to talk to us about that following their
Mm.
treatments of breast cancer.
Yeah, the effects of radiotherapy, some people won't actually even notice them till after they've finished the treatment, do they? Because it carries on working after you've finished the treatment. And three
Yeah,
weeks is really early days, I would
yeah,
say. Yeah, there's still lots going on in the breast or chest area. So it is very early days, and what you wear might affect the level of comforts and pain relief. But as Sally says, it's always a good idea to let your treatment team know that this is what you're experiencing, and is there anything that they in particular recommend that might help ease that. But it is early days for you. Um,
yeah. And I think listening to your body, and doing as little or as much as you feel able. I think you know again, it's a very personal thing. So we know that people do their arm exercises after their surgery, and some people wear kind of really comfortable kind of vest tops or soft bras and things, and then other people, want to get a bra on as quickly as possible, and they don't have as much discomfort maybe as someone else. So I think it really is, you know, gauge that on individuals. But yeah, obviously I agree with you. 3 weeks is quite early days, and probably on top of other treatments as well. We obviously don't know what they are specifically, but yeah, I think but certainly get it checked out. Again, if
yeah.
there's a concern and you're just not sure, your treatment team would want to hear and be able to talk you through that, and also any interventions that might help.
Mm, yeah, absolutely. And the other thing to sort of think, there's we run a service called Moving Forward. So if you have completed your main hospital treatment, and that's within the last couple of years, that's a really good opportunity to hear from expert speakers, connect with other women, to find out what they're experiencing or what they have experienced. And it does give people the tools to move forward with more confidence after treatment for breast cancer, because very often we know that at the end of treatment, people anticipate that they will feel relieved or elated, it's all over, and we know that that's actually very far from the truth for a lot of people, because they're kind of left, they've got the time then to reflect on what they've been through, that initial support where everyone comes forward at your diagnosis, and perhaps the surgery has sort of gone away, perhaps. And family and friends, it's very well meaning, but they're like, oh, it's all back to normal for you now. And we know that that's just the beginning of the sort of physical and emotional recovery, really. So moving forward is a great way to get those tools, get that support. We know how great peer support can be.
Yeah, and moving forward, just looking at the questions, moving forward might be something that Heather might find
Mm,
helpful as well, because Heather's asked how long does it take for the lumpectomy scar to feel flat. Again, we don't know, Heather, how long it is since your surgery, but you're saying you're finding it difficult to know if what you're feeling is a lump or scar tissue. Um, what would you say to Heather or
yeah,
Jane?
that's a really difficult one, Heather, because after surgery, obviously, it takes several weeks, months for that area that's been operated on to be what it's kind of going to be permanently, and it will go through changes. It will go through. It will. You might feel different sort of either pains or shooting sensations, and to touch it, it might feel that touch, it changes over time. It's not unusual for in that initial recovery period post-operatively, so we're talking sort of 6 weeks for the area to perhaps feel a little bit bumpy, armpit, if whether perhaps lymph nodes have been removed. Um, but it comes back to, if you've got any worries or any concerns, then it would be checking in with your treatment team. Um, Often we've got information about sort of caring for scars on the website. Often they'll be sort of recommending sort of some soft massage. Sally, is that what you would say when you were in practice to?
Yeah, yeah. I think initially, find out what the cause of,
Mm,
certainly get that assessed. And again, your treatment team will have seen you initially put, so they can help you kind of navigate. Actually, it has changed significantly, or it hasn't changed, or that looks like, or feels like normal scarring on examination. And then, you know, once you kind of know where you are with that, yeah, things like, and some people, as you say, yeah, try massaging it, or and again, it just depends where your scar is as well. So
mm,
if your scar is kind of on the outer part of your breast, maybe where the seam of your bra is, and if you wear underwiring, or if it's on the lower part of your breast again, where all of these things can perhaps have an impact on how that's feeling. So it's just
mm,
kind of it's going back to getting to know a new normal, I think, is a
mm,
phrase that some people use. And you talked about the moving forward course and what we know, those people that have completed their hospital based treatments, that kind of knowing what's the new normal going forward
mm,
from lots of perspectives. So, but certainly, we're having a conversation about that kind of physical perspective, and when will I know that something I should report something, and when do I think that's really hard to navigate. And again, we would reinforce that, see your team. If you've got any concerns, get those checked out. And some people do find over time that process becomes easier, but I think you know navigating your way through the completion of breast cancer treatments and the changes to maybe your body image and how your body looks, and any scarring and stuff um, can can be quite challenging for some people. And it would be getting support, and in that moving forward you'll often find that there are other people that have been through the same thing, and they're having the same feelings, and some
yeah.
and ways of coping.
And it's not unusual, is it, to certainly initially what we hear from uh, volunteers or people that facilitate the moving forward course, and those that ring the helpline, is that initially every sort of ache, pain, lump in the area can really trigger off a lot of anxiety and worries. And it
Yeah.
is that anxiety. It's getting it's getting support with that, which is key. Which, like you say, Sally's about getting it assessed, moving forward, talking about it. But over time, people do find that anxiety becomes much more manageable, and it doesn't. You don't get on this sort of runaway mind thing of it's got to be something cancer related. So it's important to bear that in mind. Is that things sort of those anxieties and worries that you have initially generally do get better as time goes on. Um,
Yeah, and again, we know this as, nurses working at breast cancer now through the work we do, and your healthcare professionals will be, will get to know you, and again, it's not bothering them. I think,
mm,
it's not uncommon for, to have that contact while someone is just trying to navigate their way through what is the new normal, what should I
mm,
report, and I think, so yeah, don't ever feel like you're bothering the clinical
yeah,
teams either. Get these things checked out.
yeah, yeah, exactly. So Emma asks, I am in year 9 after HER2 breast cancer. I am being kept on for checkups. Is this usual?
I mean, what we know is in follow up in breast cancer, some people will be having what we call kind of open access follow up. So they'll been assessed that they will still, dependent on the type of surgery that they've had. So if people have remaining breast tissue either in the breast that's been treated or they haven't had any treatment to the other breast, that they will continue having mammograms, or for some people there's discussions around things like MRI, and it really depends on how your breast cancer was diagnosed, because we know there's, a type of breast cancer called lobular breast cancer that isn't as easy as detectable on mammograms. So I think it's just having that conversation when you finish your treatment with your team around what does my follow up look like. Will it be mammograms? And as I said, on individual cases, sometimes MRI, but it's people will continue having that breast imaging until they are eligible for the breast screening program. So that would be until they're 50. So obviously we don't know how old it's Emma, did you say?
Emma,
Yeah.
yeah.
So obviously we don't know how old Emma is, but people under 50 will tend to continue that follow up until they are of breast screening age. That might be the reason why.
Mm,
Or I think if you're unsure as to maybe why your team are continuing that follow up, you could have a conversation with them about that and kind of ask their
mm,
underlying reasons.
mm.
Would you add anything to that,
Yeah,
Jane?
no, absolutely. No, I don't think I'd add anything else, Sally, to that. Yeah, like you say, it does depend on age and individual circumstances. So
Yeah, and I
yeah,
think it's understandable to, for people to try and compare to other people as well. So because that's normal in life, isn't it? And but what we know is, for some people they may not be able to kind of continue examining themselves for whatever reason, and
mm,
so they may discuss with their team, but still be having scans and things. So yeah, I think it's that's not unusual for people under the age of 50, but I think again, if you're over the age of 50, just have a discussion with your team
mm,
as to their reasoning around that.
mm. Do you want me to carry on, or do you want to ask one, Sally? I don't want to.
No,
Would like.
that's fine.
Would you like? So Louise says, I had a mammogram in November 2022. I was diagnosed with breast cancer January 2023. I have to book a mammogram this month, but I don't feel confident cancer would be shown, which is understandable because obviously that's a very short time frame, isn't it, from November 22 to January
January 20.
23.
Yeah, again, obviously we don't know the kind of the details around Louise's diagnosis. So what we know, I mentioned about lobular breast cancer sometimes not being as easily detectable on mammogram. Sometimes there can be kind of differing reasons, but it's understandable that you're kind of questioning about having further mammograms. What we'd say is the mammograms, once you've had a breast cancer, dependent on the type of treatment you've had, if you've had, the lumpectomy, then, there is the area where the cancer's been treated, that they will be kind of on that imaging, monitoring that area for any changes in that follow-up, but also for other potential changes that could show up on
Mm.
mammogram, and also monitoring the other breast. So we would say it is still important to continue having
Mm.
those mammograms for those reasons, but we can appreciate why you maybe would have
Yeah.
less confidence in them, and I think again a discussion with your team around that and around how you know how your breast cancer was diagnosed in terms of what imaging and things that they used, and
Mm.
and then your concerns about that kind of confidence going forward.
Yeah, yeah, absolutely. Like you say, it doesn't mean to say that it wouldn't pick up other changes or it wouldn't pick up something in the other breast. And yeah, talking to your treatment team about whether any other imaging is relevant for your follow up. But it's understandable. We do hear that, and it is understandable to think that if it wasn't picked up, um, so it sounds like perhaps Louise developed a symptom between that time. And that's why it's always important to remain breast aware, even between screening
Yeah,
appointments, because although that is particularly quick, breast cancer can develop in between screening mammograms. So it's important to stay breast aware, even if it is quite soon after a screening mammogram, and report any changes to your GP. But Louise, by all means, give us a call
yeah,
tomorrow. We're happy to talk through this in more detail with you. You or anyone else can also call us and leave a message now. We are closed, but you can leave a voicemail and we'll call you back tomorrow. And we're also open on Saturday mornings, 9 till 1. So if you wanted to give us a ring, anyone wants to ring us on Saturday, they're very welcome to as well. So do give us a call and we can talk that through in more detail with you, Louise. That's no problem at all. Um, Joan is asking about vitamin B12 with exemestane. She's been on hormone suppressant for 6 years and is feeling tired. Should I go for that one?
yeah. I mean, I would initially be saying, speak to your doctor or your treatment team about why you might be feeling tired.
Sounds like it's a new
Yeah,
symptom, doesn't it? So yeah, establishing that cause initially, in case there's another reason for it, whether that's some anemia, some thyroid problems, or anything else that's going on that might be impacting on your energy levels, and that's why you're feeling tired. We know for most people, if they have a healthy, well balanced diet which is based on the Eat Well plate. Which is accessible on our website, the NHS website. People shouldn't really need vitamins because they would get everything from their diet unless they had a problem with sort of absorption. I'm not aware of vitamin B12 being an issue with in this situation, but there are other situations where it might not be advisable to take it with other medications, and we always suggest talking to your treatment team, GP or a pharmacist if you're considering a supplement, a dietary supplement, unless lots of women are prescribed calcium and vitamin D as part of their treatment ongoing. There is a really good website which we use, which is the Memorial Sloan Kettering Cancer Centre. So that's mskcc.org. It is an American website, but it's a database of practically every supplement that you can think of, and it will give you a patient and caregivers version as well as a healthcare professional version of the information, and it explains what potential side effects are of supplements, when you can't, what it can interact with, what other drugs it might interact with, or other So do take a look at that as well. But like Sally said initially, it is about just double checking in case that, you know, what's the reason for this fatigue. So yeah, that would be the best course of action for you, Joan. Also, just to mention, we're coming sort of summing up now. Really, we're coming to the end of tonight's session. I hope it's been helpful for everybody that's asked questions. For anybody that's joined us and not asked questions, I hope it's been helpful as well. We do have a range of services as well as the helpline. So moving forward, we've mentioned we also have Someone Like Me, where we can put you in touch with somebody on a one-to-one basis. So that's for people with primary breast cancer or people with a genetic mutation, mothers of mothers whose daughters have got breast cancer, and we have dedicated services for younger women and women with secondary breast cancer, and also with Someone Like Me, we do have men with breast cancer as well. So if there's any men out there that are watching this with breast cancer and would like to connect with other men, because that can be quite isolating, because obviously the numbers are far fewer than women diagnosed with breast cancer. So we do have services really for everybody and anybody, and that's, like I say, the helpline's there for everybody as well.
And we have our forum.
Forums, yeah, our online community, which is really helpful as well. And these sessions, we do put in a survey, so any sort of comments you've got, any suggestions for any other Facebook Lives, any topics that you'd like to see covered, please do pop that in the survey. Just to say, the next Facebook Live we have on is on Monday with our colleague Addie. She's been joined by a guest, and they are talking about the breast screening procedure. So do join us for that one. And we'll just say good night and thanks ever so much to everybody for joining us.
Yeah, night everyone, and do reach out if you need us.